Previously, we have undergone the root canal procedure and it was a success. This time, we are going to undergo the dental crown. Though as simple as it may seem, I believe there is yet to know more about such procedure than just covering the teeth for aesthetics. Last time, we saw our dentist to look out for our aching tooth. It had been a rough time. However, after undergoing the root canal treatment, I felt a lot better. This time, we are going to undergo the dental crown procedure. And as simple as you know it already, I believe there is still an importance for you to know more about such procedure. Anyways, let's go. Before getting into the procedure proper, I was done with a hairnet to cover up my head, as well as a patient count to cover up my body. You may find it exaggerating when the tooth is the only thing getting the treatment, but it's always important to stay safe by means of guarding every body part. The procedure was a 2-sitting session where I had my initial treatment with Doc Aubrey first. She was a jolly dentist who had treated me with utmost attention. This is a picture of my tooth getting temporarily capped. I know it's not pleasing to the eyes, and my teeth are not the best looking ones, but we're just being realistic. Anyways, undergoing the dental crown procedure felt that I was at ease because it was a procedure that wasn't as crucial as other dental procedures. Unlike the root canal treatment where my tooth and the oral area itself got treated and saved, and it had really ached at the time, the crown procedure didn't involve any pain because the tooth was just going to get capped. By the way, the type of crown that I was undergoing was Zirconia crown, a crown made from zirconium dioxide that has numerous advantages as it is strong, durable, and long-lasting. To start things first though, let's learn more about the procedure itself. Doc, what is the dental crown procedure?
Okay, so dental crowns are placed on teeth, well, to make it more aesthetic. In our case, a root canal treated tooth, so you place a crown on it to make it last longer.
Ah, so that's why I had 2 sessions, because they needed to get the right shade of my tooth in their lab. Well, learning a little of their facilities, it's good to know that they are using the best tools, modern machines, and high-tech equipment in providing their oral services. It's a plus to know that they do not only excel in welcoming and providing patients with care, but also they have top-performing technicians and best equipment to utilize in both patient care and tooth care. Can you give us a short description of how is it performed?
Okay, so first we get the shade, so we will get the right color of the tooth, then reduce a little around the tooth so that we can prepare it for the bulk of the tooth. Then we take an impression, send it to the lab. Then the last step would be removing the temporary, placing the final crown, cementing it, and check if there's anything that's high or low in the teeth.
By the way, crowns or jackets can serve as bridge for the teeth. They are also classified according to what material to be used, a metal or a non-metal one. Under the metal type material, porcelain-fused metal crowns, simply known as PFM crowns, are fabricated with a metal alloy interior and a porcelain exterior. Basically, it allows them to have the strength of metal crowns fused with aesthetics. On the other hand, under the non-metal type of material, we have lithium disilicate or EMAX, which is best for front teeth with obvious purpose for aesthetics. We also have zirconia crown, the crown procedure I have undergone, which is the best material as it's the strongest crown made to withstand very high pressures. Doc, does the procedure vary per type of tooth?
Yes, definitely. We can place an onlay, an inlay, a veneer, but in our case, we will place a crown. It depends on the position of the tooth and the damage. For example, if it's extensive, I suggest that it's better to place a crown. If it's only on the top of the tooth, it's either onlay or inlay. It's better than composites, restoratives. For the front teeth, veneers are better, but if the damage is extensive, we can also place a crown on the anterior, on the front teeth. So Yes, it varies. It depends on the damage and the position of which kind of tooth.
Indeed, it is vitally important to take care of our teeth. Just as what Doc Joseph had exemplified, as far as I remember, there were definitely tooth concerns and aches in the past, especially when I was a lot younger, with me being into sweets. By the way, other than crowns, it is worth mentioning that we also have onlays, inlays, and veneers, dental procedures that dentists could conduct depending on the tooth concern. Doc, given how it is not as a priority as others may think of when it comes to visiting a dental clinic, how important is it to take care of our teeth?
Okay, so I just want to give an example. There was this study that I came across. It's about the Filipino students, maybe in elementary. There was a study that most of their absences from class are because of dental pain, more than sickness, more than accidents or whatsoever. So that's missed classes and lower grades for them. If you can just imagine, how about more with adults? So missed work. It's a priority because as a heart of a dentist, it is our goal to inform our patients, educate them how important it is so that they will take care of their own teeth and their children's children. Taking care of your teeth is actually a wise decision because it will pay dividends in the future. It is an investment. It's actually more costly not to take care of your teeth, given the example that I cited earlier. So truly it is an investment to take care of your teeth.
Of course, as people of average families, we have our own respective necessities needed to be prioritized first. However, if we have the means to, or at least have an extra budget that we can use, we can find the time to give our oral health a checkup. You might not recognize it, but taking care of our teeth is a part of taking care of our overall physical health. Just as how we take care of our bodies, it's also equally significant to pay attention in our oral health. We might not recognize the essence of it today, but let's not wait for that time of getting a toothache before considering seeing a dentist. Let's always think of things as our investment in the future. By the way, as for the price ranges in the clinic concerning dental crown procedures, metal crowns such as porcelain-infused metal ranges from 6,800 to 9,500 pesos. And non-metal crowns like lithium disilicate or EMAX is 16,000. As for the zirconia crown which I've undergone, costs 22,000 pesos. The right crown procedure would still vary depending on the tooth situation, but most of the time, you'll be the one to pick which procedure would you undergo. As for me, of course, I would recommend Zirconia Crown Procedure. Not totally because it was the suggested treatment nor I had the budget, but because it was the best crown procedure that was being offered. If you're a person like me who aims for quality, I suggest that you aim for the best if you've ever been given an option to pick. Of course, there would be some cases that this principle do not apply, but trust me, most of the time, it's right to pick the best, especially if it's just going to be for you and you have the means to obtain such a selection. To conclude, stronger teeth means stronger confidence. Undergoing the dental crown procedure felt good because it gave way for an opportunity to even further protect my tooth that had been previously treated with a root canal treatment. Today, I learned that it's really important to seek the right clinic, and most especially seeking the right dentists. Of course, my impression of seeing a dentist would have been not so well, and I would have never recommended any clinic at all if the services wasn't good. However, at the clinic I found, they were all just nice, accommodating, and professional. More than to that core memory of learning the importance of brushing regularly in 7th grade, now that I have become a young man myself, I learned the importance of seeing a dentist and taking care of our teeth with better care through means of undergoing dental procedures and services. Truly, taking care of our teeth is an investment. let's give way to also prioritize it if we ever get to have an extra budget. Alright, thank you so much for watching, and if you find this video odd, make sure to hit the like and subscribe buttons, and I'll see you again on the next video. This has been Jay, wondering, how odd, isn't it?